Well, it's hard to believe open enrollment time is here again. Things are obviously very different because of the pandemic. Hopefully things get better soon so we can hold group meetings again. I really miss seeing all of you. This is a very different way of doing meetings. For those of you who don't know me, my name's Michelle Hammock. I'm the account manager that works with Bridges on the employee benefits. I have one of my colleagues here with me today, Lee Penner. She helps me with the Bridges account. Say hi, Lee.
Hi, everyone.
So just like every year, we like to take some time and go through all the benefits to share with you so that you can make your employee elections for the upcoming year. As most of you know, February is the open enrollment month. So the benefits actually run March 1st through February 28th. So this is the month that you can come onto the plan, make changes to the plan, go off the plan. You can even change plans from one medical plan to the other. If you're a new hire, your 60-day waiting period still applies. So the good news is Bridges is staying with United Healthcare, Principal, and Fresh Bennies for the employee benefits for 2022. The other good news is that the employee costs are also staying the same. You will see that on your employee election form that you should have in your email that you received from Bridges. I'm going to do a very high level overview of the plans, just like we've done in the past. And with that, I am going to share my screen and pull up the employee booklet. And we're going to take some time and go through that. Okay, here's the first page of the booklet. So the second page. This starts the two medical plans with United Healthcare. The first plan that we're going to go over is what we call the buy-up plan. Both plans are PPO plans. PPO meaning there are in-network and out-of-network benefits. Both plans have two networks within the in-network. Most of you might recall the Tier 1 network is the designated premium network. We've always talked about the smaller network and the bigger network that United Healthcare has. With the designated network, if you are seeing doctors that are part of the designated network, you will pay less for some benefits. And we'll touch on some of those in a little bit. But as some of you may not know, costs that you pay can vary for different doctors for the same service. So what United Healthcare has done is they've set up this smaller designated network of providers that you can choose from to help reduce your overall cost. And again, this applies to both plans that we're going to talk about. So with the buy-up plan, and I'm just going to focus on the in-network level of benefits, the deductible runs on a calendar year, January through December. The in-network deductible for a single is $5,000. And if you have a family plan, the maximum is $10,000. One person in your family will not exceed that single deductible amount. After the deductible is met, you will go into an 80-20 co-insurance. United Healthcare covering 80%, you as the employee, the other 20%, to a maximum out-of-pocket of $71.50 for a single, $14,300 for a family. This plan has co-payments for office visits. So for primary care office visits, you have a $15 copay, and that's whether you're seeing a designated network provider or a network provider. The second network in this plan, actually both plans, is what United Healthcare calls their Choice Plus network. I do have a page that we will go through that will show you how you can find providers that are in both of these networks that we're talking about. The copay, again, for primary care office visit is $15. For children less than age 19, it's $0. If you're going to a specialist, the specialist office visit for a designated network provider is $50. And if you're going to a provider that's not part of that smaller designated network that we talked about, but they're in the Choice Plus network, you'll pay a $100 copay for a specialist visit. You also have virtual online visits with the United Healthcare plan. The virtual online visit is a visit that you can do virtually online with a doctor with United Healthcare. And the cost to do that on this plan is $0. So for minor health conditions, say you have a cold or a sore throat, you have the flu, you want to set up an online visit with a doctor so that you don't have to make an appointment with your primary care doctor, you can actually do that with a virtual online visit with United Healthcare. Urgent care. There's a $25 copay for urgent care. So as long as you're going to an urgent care that's in the United Healthcare network, it's a $25 copay. Other services received in a urgent care would be subject to your 20% after your deductible is met, which again, $5,000. The emergency room copay for this plan is $300 with a 20% copay after the $5,000 deductible is met. Hospital services, inpatient and outpatient, are subject to the deductible after 20% after your deductible is met. And then your prescription plan. The prescription plan is a 4-tier prescription plan. It is the essential 4-tier prescription drug list with United Healthcare. You can see the 4 levels of copays for this plan. So tier one are going to be your lower cost, typically your generic medications, some brand name, 10, 40, 85, then 250 for tier 4. You also have the option to do mail order, where you can, maintenance medications can be filled through the mail. And you can see those copays that are listed there, again, for the 4 different tiers. And you can get up to a 90-day supply by using the mail-in prescription. Let's see, bear with me. I'm going to go to, oh, I think I jumped too quick here. Sorry. All right, we're going to go to the next page, which talks about option 2. This is what we call the base option. This is a high deductible health plan. It does not have copays prior to the deductible being met. So with this plan, and again, you've got the designated network and the Choice Plus network. So you have the 2 networks within your in-network column of benefits. With this plan, you have a $3,000 single deductible, $6,000 for a family. Your coinsurance is 20% or 40%. So depending on whether you're going to a designated network provider, so again, the smaller network of providers, you'll pay a 20% coinsurance after the deductible, or 40% if you're going within the bigger network, which is the Choice Plus network. After your deductible is met and you're paying your coinsurance, your out-of-pocket maximum for this plan is $6,750 for a single, $13,500 for a family. So that's your maximum out-of-pocket for this plan. Preventive care on both plans are covered at 100% in network. So to go see your doctor for your yearly checkup, your preventive care well checkups is covered at 100% by United Healthcare. You can see for primary care and specialist office visits, again, you have your 20% after your deductible or 40% after deductible if you're using the Choice Plus network. For the virtual online visits for this high deductible health plan, you can use the virtual online visits through United Healthcare with a copay of $49. So again, to see a doctor for any minor health conditions virtually through your phone, iPad, computer, it's a $49 copay. And then you can see for all the other services, urgent care, emergency room, hospital, you're subject to your coinsurance after the deductible. Again, this is a high deductible health plan. It does qualify for a health savings account that you can open up with any bank of your choice. Before we go to the next page, I want to talk about the prescription drugs. Here at the bottom, you'll see there are copays for the tier 4 drugs, but your deductible applies before these copays would kick in. So after your $3,000 or $6,000 family deductible has been met, then for any medications, you will start to pay these copays depending on the tier of your medication, and you would pay these copays until your maximum out of pocket is met of $6,750 or $13,500 for the family. Next page. So the next page talks about the health savings account. So for the base plan, that's a high deductible health plan. Again, this qualifies you to be able to open up a health savings account with any bank of your choice. The IRS does limit us on how much we can put into our health savings account. But the idea with this plan, because it does cost less than the buy-up plan, is to take those savings, maybe open up a HSA account, put them in there, and get the tax benefit from having this health savings account. Qualified medical expenses, as we talked about, since you don't have copays that apply for this plan, the base plan, the idea, since you have to meet your deductible first, is that you put money into a health savings account to help you pay for those qualified medical expenses with tax-free money. So again, you don't have to open up HSA account with a bank. It's up to you. That's your choice. It's not mandatory, but highly recommended so that you get the tax benefit of having that account. The next thing here at the bottom, this just talks about the virtual visit that we already talked about in the summary of the benefits. Again, with United Healthcare, if you are enrolling with one of the United Healthcare plans, you have this virtual visit option with United Healthcare. With the buy-up plan that we talked about, again, doesn't cost anything to use the virtual online visit, but with the HSA base plan, the cost is $49. So just a little bit more information there for you. The next page talks about the essential prescription drug list with United Healthcare. So we talked about the 4-tier level medications. Here you actually have the link that you can click on to help you find what tier your medication falls in. Keep in mind the essential formulary drug list with United Healthcare. This is a closed formulary prescription plan, which means if you find that a medication that you're taking is not on the list, it would not be covered. If you run into a situation like that, I recommend that you get with your doctor so that they can work with United Healthcare to help you find a medication that's in that therapeutic class. for whatever condition you might have, to finding a medication that is on the formulary list. Or if you've tried other medications that are on the list that doesn't work, your doctor can work with United Healthcare to hopefully get a prior authorization for that drug. So this page here just talks a little bit more about that. Wanted to make sure that we touched on that. Next page. So this is something a little new. Well, it is new, but it's not going to feel really new to some of you, especially those that have been on the plan. This is something that we've talked about every year. Lab networks. In the past, we've talked about with United Healthcare, if you go to an independent lab for your lab work, such as LabCorp or Quest Diagnostic, that you are going to see expenses or costs that are less than if you were to go, let's say, to an outpatient hospital facility for your blood work. Effective March 1st this year with United Healthcare, and this applies to both plans, they have added a designated diagnostic lab network. So basically what this means is starting March 1st, in order for you to get the designated network level of benefits, so the deductible and the 20%, you'll want to make sure that you are going to an independent lab such as LabCorp or Quest Diagnostic for your lab services in order for them to be reimbursed at the 20% coinsurance level. If you don't, and you happen to, let's say, go to a hospital or an outpatient facility that is not part of the independent lab network, then the lab service is going to be subject to the deductible and 50%. So it's going to cost you more in your coinsurance by going outside of the independent lab network. So just want to make sure that you are, when you do have lab services that are needed, talk with your doctor about that. If your doctor is doing lab services in their office, if they do the blood draw and they're going to send it out, please have a conversation with them about where they are sending your lab for testing, because again, it's going to be real important that they are also using an independent lab such as LabCorp or Quest versus maybe, say, sending it to a hospital for the lab services to be tested. So any questions that you might have about that, since it is a little new, please don't hesitate to reach out and we can talk more about that. But the important thing is just making sure that you go to a LabCorp or a Quest Diagnostic. Okay. Next page. This is a screenshot of United Healthcare's system. Most of you that are on the United Healthcare plan already may already be familiar with this. But this is just showing you how you can go to myuhc.com and register. Highly recommend that everybody take some time and do that if you haven't already. Provides a lot of great information. If you lose your ID card, you can order a new one. You can check the status of a claim. You can see how a claim's been paid. Look at your benefits. Check for providers that are in the network. So we talked about the premium designated tier 1 providers. You'll see at the bottom of the screen, it shows you when you go to myuhc.com how to look for the 2 heart symbols. That is how you know if your doctor is part of that smaller network that we've talked about, that premium designated tier 1. So just make sure you take some time and look at that. But again, take some time and get registered on myuhc.com because there is a lot of great information there to access for your benefits. Okay, next page also talks about a little bit more about myuhc.com and just some other things that that you can get by being registered with myuhc.com. So not going to spend too much time on that. Also talks about Rally. Rally is basically an engagement tool to help members for healthier living lifestyles. So not going to spend a lot of time on that, but just take a look at that and know that that's there as well. Two new things to talk about with United Healthcare this year: Apple Fitness and Peloton app. United Healthcare is offering a free annual membership for anyone that has a Apple Watch, and this would be Series 3 or newer. You can actually, with your Apple Watch, get signed up for different fitness services. The value of this is about $80. But again, this is something United Healthcare has partnered with Apple, and then you'll see the Peloton here below, but just gives you some different workout routines and things that you can do in the luxury of your own home and not having to go out to a fitness club. So just a lot of really good services here that are being offered. You'll see talks about some yoga, video workouts, just a number of different things. Again, you'll want to register at myuhc.com in order to get an activation code so that you can go to the app for both of these services and get a free annual membership. So when you go to the app, you'll put in the activation code that you get after you've registered on myuhc.com. For the Apple Fitness, for anyone who's interested in joining to get this free membership, you have until October 31st of this year to activate the membership. And if you're interested in the Peloton, you'll want to activate that by June 30th. If anybody is watching this video sometime down the road where we get past these dates and this is something that you're interested in, get with HR because things may change and these dates may be extended after today. So take a look at that if you're interested. I think it's a really great added value benefit for everyone. Okay, the next thing we're going to go into is the dental and the vision, and then the life insurance. So the dental and the vision is with Principal. So again, no change with the benefits on the dental and the vision with Principal. So I'm just going to touch really quickly on what these benefits are. Just like the medical, this is a PPO dental plan. So you have in-network and out-of-network benefits. Obviously, if you stay in network, you're going to get the better benefits. So highly encourage everybody to try to stay in network with the dentist if you can. But if not, you do have some out-of-network benefits. You'll see the percentages are different if you go out of network. But in addition, if you go out of network, you could be balance billed. So actually, you could see a higher out-of-pocket expense by going out of network. So in network, again, it's a calendar year deductible. It's a $50 per person deductible, $150 max for a family. The calendar year maximum benefit is $1,500 per person. Your diagnostic and preventive benefits, which are typically your exams, your cleanings that you get twice a year, fluoride treatments for children, bite wing x-rays, covered at 100%, not subject to the $50 deductible. So highly encourage everybody to get into their dentist to get their yearly cleanings. Then basic services. The basic services, some that you see listed there, is subject to the $50 deductible. Once that's met, then principal is covering those services at 10%. So this would be fillings, root canal, periodontic services, simple extractions. Major services, this is when you're getting into more expensive type services, crowns, bridges, dentures. After the $50 deductible, then it's 40% coinsurance. There is orthodontia for children up to age 19. It's a 50% benefit with a lifetime maximum per child of $1,500. Vision. The vision through principal, the network is VSP, the Vision Service Plan. It is their choice network. For the vision, this allows an eye exam once every 12 months, for lenses every 12 months, and then frames every 24 months. You could do glasses or contacts each year, but not both in the same year. For an eye exam, it's a $10 copay. And again, this is in network, as long as you're seeing a VSP provider, which I think many of you do. This is a network that Bridges has had with the vision plan for many years, and everybody seems to really love it. So I think everybody's been able to find that their optometrist is in the VSP network, which is great. So a $10 copay for eye exam. Prescription glasses has a $25 copay. Your in-network frame allowance, so to get frames, is $130. And then contact lens as well. Oh, sorry, bear with me. I want to go back. I jumped too quick. Just a reminder, the dental and the vision is offered as a package benefit. So if you're electing dental, you're going to get vision and vice versa. So when you complete your employee election form, you will see that the cost per pay lumps the two together. Okay, so they are both offered together. Just wanted to mention that. Next, fresh bennies. This is something that we added last year. Fresh bennies actually offers several different services within their program. Telehealth, very similar to the virtual health that we talked about with United Healthcare. Some of you may be looking at this and thinking, well, if I do fresh bennies and I have United Healthcare, which one would I use? If you sign up for the fresh bennies and for the telehealth, the virtual online visit, obviously, just to remind you, on the base plan with United Healthcare, remember that's a high deductible health plan, and the cost for the virtual visit was $49, and that's each time that you would use a virtual visit. With the buy-up plan, if you elect that, remember the virtual visit was a $0 copay. With the fresh bennies, if you sign up for fresh bennies, there is no cost at the time that you use the virtual visit through fresh bennies, but there is a cost per pay to have the fresh bennies benefit. We'll talk about that here in a minute. I just wanted to spend a couple minutes though on this page showing you the different services that Fresh Bennies offers. So again, you have the telehealth. This allows you to do a virtual online visit with a doctor for any minor health condition, and you don't pay anything for that visit at the time. And it's unlimited throughout the year. And this is for you and any family members. And you'll see the cost for this is the same, whether you're signing up just for yourself or for any family members. The other thing that I think is real important to point out with Fresh Bennies is the Advocacy Plus. So just to remind you, especially those of you that are already on Fresh Bennies, and if you decide to continue Fresh Bennies, really take a look at the Advocacy Plus and familiarize yourself with all the things that it's there to help you do. This Advocacy Plus is there to help you. So you actually have a support person from Fresh Bennies that will help you with your healthcare benefits. So whether you're with United Healthcare or have other coverage and you're looking for, let's say a doctor, you want to know if a doctor's in United Healthcare's network. And remember, we talked about the designated tier 1 doctors versus the bigger Choice Plus network. They can help you in finding doctors that are part of either one of those networks to help you bring your costs down. They're there to help you find lower cost medications, help you compare costs for procedures, negotiate medical bills on your behalf. So there's a lot of things that Fresh Bennies does under the Advocacy Plus part of this program. And I really would love to see everybody take advantage of that and use that because it's there and they're great to work with. I'm not going to spend a lot of time with some of the other services, but just note that there's also behavioral telehealth that's part of Fresh Bennies. So for those of you that would want to consult with a therapist, you have that as an option. There is a cost for that on here. The other thing that's nice about Fresh Bennies as well, if you're not enrolling, let's say with one of the United Healthcare plans, but you enroll with Fresh Bennies, this also gives you access to being able to see a primary care provider or a specialist for any health conditions that you might have. So kind of keep that in mind too when you're looking at Fresh Bennies. There's also the prescription savings, some vision and dental savings. So a lot of really great things here. The other thing too, Bridges pays half of the cost of this for those employees that elect Fresh Bennies. So basically the Fresh Bennies cost, it's $9.99 a month, and Bridges is splitting that cost with you. They're paying half and then you pay half. So you'll see that on your election form if you decide to enroll with Fresh Bennies. In addition, and I'm going to go to the second page here of Fresh Bennies, you also have the option, and these are add-on benefits. So if this is something that you're interested in, you can elect to add these on and pay 100% of the cost. But there's the security pack and the pet pack. And I know some of you that have Fresh Bennies, you signed up for this last year. And anybody that's wanting to sign up for it this year, obviously now's the time that you can do that. But the security pack has the identity theft protection included in it. So it includes fraud monitoring and identity management services to reduce the risk of identity theft. So you've got that available to you under the security pack, as well as legal savings. The pet pack, it's also a telemedicine, telehealth service for your pets. This is for cats and dogs only. So those of you that have any pets and would be interested in signing up for the pet telehealth, it's $9.99 a month. And this helps you to also be able to reach out to a veterinarian to do an online chat or a visit with them, with your pets, if you have any questions or in need of any services for your pets. It also includes some savings for medications, food, toys, and a number of other things. So take a look at that. And again, you will see these options on your election form if that's something that you're interested in signing up for. Then the last thing we're going to be getting into, and while I am going through the life insurance, I'm just going to be touching on this really quickly. I'm going to ask Lee to, in a minute, pull up our contact sheet so that you can have our contact information, our phone numbers, and how you can get in touch with us if you have any questions. But real quick on the life insurance, the group term life insurance, which is also with Principal, Bridges offers a $15,000 term life and accidental death and dismemberment benefit to all eligible full-time employees. The cost is 50 cents per pay. So if that's something that you have and you want to continue that, you'll do that, mark that on your election form, and the cost is staying the same. For those of you that maybe don't have the benefit currently, and you want to enroll, now's the time that you can do that. I believe if you don't have it and you want to sign up, I believe you would have to fill out a statement of health. I actually might have to check on that. But let us know if that's something that you would want to add this year, since it is open enrollment. On your election form also, there is the voluntary life insurance. So voluntary life insurance, again, this is something else that we added not too long ago with Principal, but this gives employees the option to purchase additional life insurance for yourself, your spouse, and your children. So I'm not going to spend a lot of time on this. If you're a new hire, definitely take a look at that. And you would want to, sign up as a new hire to get some guarantee issue on some benefits. But for those of you that have been with Bridges, if you don't have any of the additional life insurance benefits now and you're interested in doing that, there are some levels of benefits that you could sign up for where you would not be subject to a statement of health, some areas where you might. So again, just take a look at the election form and that'll give you some guidance. But it does allow you to purchase some additional life insurance for you and your family members if you're interested. There's a note page for you guys on the form. And by the way, this booklet should be attached to the email that you received. So you'll have it as a reference. The last page of the booklet just gives you some important numbers and websites on all of the benefits that we've just gone through. So just know that that's there for your reference. And I am going to stop sharing my screen. And I'm going to have Lee go ahead and put up our contact page. Okay, there we go. And I don't know, I'm assuming you guys can still see me, but here is our direct number to our office, both Lee and myself. We appreciate your time. Yeah, Lee, I think I see you hovering over the election form. Can you go ahead and maybe bring that up? There we go. So, yep. So this is the open enrollment election form. I know this is going to look familiar to most of you. This is what you're going to fill out for us and bring to HR so that we can either get you enrolled or make changes to whatever benefits that you want to change for the year. So real important that everybody get this filled out and turned in. Even if you're not electing any benefits, we still need you to fill this out. There is a section here on the election form that allows you to waive, which there it is right there. If you are not enrolling in any of the benefits, again, we're going to want you to fill this form out and complete section J and just let us know that you're not taking any of the benefits. But the rest of the form, it'll guide you through to let you know what to elect for this year. And we'll go back to the contact screen. Again, Really appreciate everybody's time. Stay healthy and safe, and hope to see you guys real soon. Thanks for your time.